Patients are being impacted one at a time when artificial intelligence is applied in the right way. So we can talk about algorithms or evidence-based care pathways, but artificial intelligence, when it impacts a single patient's life, makes a difference. I'll tell a story from one that was just shared on stage, and I have permission to share it. It was a patient, one of the practices that we partner with, and this patient was identified as at risk for mortality in the next 30 days. Now, she was stable in her cancer care and didn't look like anything out of the ordinary, but because she appeared for the first time on the list of patients at risk, they called her in to just see how she was doing, evaluate her, and to see if there were any issues. They did some blood work and sent her home. She didn't really have any significant complaints and seemed like a bit of a insignificant visit. Shortly after she got home, an hour or two later, the friend that drove her in called and said she had had a syncopal episode. By that time, her blood work came back, and her kidneys were not working well. The creatinine level had been rising. Her blood sugar was high, it was 300, and she's not a diabetic, and her potassium was low. She promptly was sent to the emergency room, and turns out she had urosepsis, which is a bloodstream infection related to the urinary tract. Had she not been brought in for that visit and her caregiver provider not been with her when she had that syncopal episode, this could have turned out very differently. And nobody would have anticipated this ahead of time. That's the power and the impact of artificial intelligence.